Summit Community Care Clinic was started 26 years ago by a group of dedicated medical professionals in our community who came together to meet the needs of the uninsured. We started our integrated care program in 2006, which added behavioral health services. Our behavioral health program has grown from one therapist for 8 hours a week to 14 therapists for over 500 hours a week. We serve Summit County, Lake County, and Park County and have behavioral health services in each of the schools in those areas. Although the services in our schools have expanded greatly over the years, we still find that our youth are in need of mental health services and the demand just isn't going away.
I was struggling a lot at school and at home, and I ended up seeing you eventually and being able to go to DBT.
So the DBT program is our comprehensive program. It's dialectical behavioral therapy. So the dialectic is this idea that kids are trying as hard as they absolutely can, and they've got to try a little bit harder and do something a little bit different to feel better. The B is obviously behavior, and the T is therapy. It's a comprehensive program, so it includes multifamily skills group, it includes individual therapy, and it includes phone coaching.
Before DBT, I was struggling a lot, and by the time I started talking to you again and you told me about DBT, I was really willing to go, since you told me I could do it with my mom, and that was a person I was struggling a lot with. I struggled a lot because it's a lot of new things and you really have to put effort in order to feel better. So with the DBT group, I was able to really process things little by little without being too overwhelming. Through the months, I really improved and it really helped me. And I feel like I have changed a lot, and I really hope that it keeps getting better. I feel great. I feel like I can talk to anyone about my feelings when I used to just shut them out. I had a really hard time believing in what I had purpose for and what I really wanted for myself, because DBT is something you work for yourself, not for anyone else. It's to make yourself feel better. Obviously you do it with a family member, but it's to help them help you also understand and validate yourself, because it's hard doing things alone, so having someone to support you always helps.
The program came out of a need for a mid-level of care between kids that are being hospitalized for crisis stabilization and kids that are getting biweekly outpatient therapy. So we've created the comprehensive program to kind of fill the gap, and what we've learned is that the gap is much bigger than we thought. So not only do we have the comprehensive program, but we've created more skills groups for adolescents to have in school without their parents, and then adult groups at the main clinic, so that we're trying to fill that whole emptiness.
Since I graduated DBT, there's this light at the end of the tunnel, and it makes me feel a lot better, feeling like there's positive things out here in the world. And I really hope that I can keep seeing more things and feeling like I can still believe that there's more things to just the sad things I used to find in life.
There's no doubt that we couldn't do the work we do without the support of our community and our community partners. Strong Futures is one example of how our community comes together to meet needs, and the mental health needs of this community are great and continue to grow. So thank you for that support.